Today I'm tasked to give the Vicente Soto Memorial Medical Center Programmatic Management of Drug-Resistant Tuberculosis Satellite Treatment Center, or the VSMMC PMDT STC. I am Dr. Grace Melchor, the Chairman of the Family and Community Medicine Department. The Global Fund is an international financing and partnership organization that aims to attract leverage and invest additional resources to end the epidemics of HIV/AIDS, TB, and malaria, to support the attainment of the Sustainable Development Goals established by the United Nations. This multi-stakeholder organization is managed in the country by the Philippine Business for Social Progress, and together with the Department of Health, VSMMC was identified as the 36th in the country where a satellite treatment center was or will be established. And before the start of the STC, in August 12 of 2012, a series of trainings, both didactics and immersion in Lung Center Manila, were done to the identified physician and nurses. The PMDT STC project was in line with the Department of Health National TB Program and its commitment to achieve universal access to diagnosis and treatment of drug-resistant TB. The old TB Pavilion, or the PTSI building, is now currently the new Center for Behavioral Sciences facility. During that time, a single tent was placed outside for patient consultation and treatment, with the office inside the old building for the staff and for the storage of medicine and supplies. We started with 58 patients, mostly transferred from the Eversley Child PMDT Treatment Center. The staff was initially myself, one clinic nurse, Miss Mercy Molioneda, and a support staff in the person of Mr. Clemente Amodnia. Daily observed treatment was done from Monday to Sunday. In March of 2013, additional staff was given by PBSP. We had Ms. Aureli Dorano to be responsible for the records and reports, Mr. Edgardo Sabanal for drug and supply management, and still we had Mr. Clemente Admodia as our support staff. Full operation from case finding, screening, diagnosing, pre-counseling, laboratory procedures, enrollment process, case holding, decentralization, monitoring until post-treatment was steered by the PMDT STC staff. Now, the VSMMC PMDT STC was the 36th facility managed by PBSP, and this number was used as the facility code in the records of patients. In July 29, 2013, the first multi-drug resistant TB patient was enrolled and recorded. Now, to strengthen the relationships and enhance encouragement and positivity among patients, small gatherings and meetings were done by the staff. Serving as the second facility in Cebu, aside from the ECS Treatment Center, PBSP and the regional office decided that VSMMC will treat and manage patients only from Cebu City. The numbers, however, increased because referrals from private facilities, neighboring towns, and provinces. This increase in referrals did not, however, reduce the cure rates of the treatment center. In 2013, we had a series of unfortunate events. October 15, 2015, an earthquake with a Richter scale of 6.7 hit Cebu and Bohol Islands. The earthquake forced the staff to work outside the TV pavilion because the building was declared by the engineering staff as unstable for work. A month later, November 8, 2013, the devastating Yolanda typhoon arrived. It destroyed tents, equipment, and several supplies of the treatment center. All the medications were transferred to VSMMC main pharmacy, but the implementation of strict DOT continued despite the very difficult situation. Kudos to the committed and dedicated staff. So the single tent was used again outside, and as we can see, equipment, medications, and things were temporarily placed outside the facility. In June 2014, we were lucky enough to be given by the World Health Organization 3 container vans. So this served as a supply room, a clinic, and a washroom for both the patients and the staff. We were indeed very fortunate to be given such makeshift facility. Additional manpower as the patient number increased was given. We were finally added with 2 nurses in May 2015 and October 2015. Ms. Durano and Mr. Sabanal, however, was hired as contractual nurses for VSMMC, but they still served and helped the treatment center. In March 2016, after 4 years, the TB or the VSMMC PMDT STC building was finally finished under the able leadership of Dr. Gerardo Aquino, our medical center chief, with the help of the Department of Health National TB Fund. The staff finally had a stable, comfortable office. The STC clients and ceasing growth planted more additional manpower from stakeholders, the PBSP, the DOH Regional Office 7, the hospital, which provided physicians, DRTB specialists, consultants, organic nurses, field nurse, admin clerk, and a janitor, which made the PMDT STC turnaround operation time shorter. Year-end celebrations as Thanksgiving and recognition to treatment success and staff work were never forgotten. Regular health teachings and counseling provided support to patients and relatives, and the PMDT VSMMC STC staff continually made efforts to serve the patients with utmost respect and integrity, holistic approach to care, with the aim of providing cure for multi-drug resistant TB cases. So the facility was never spared from the COVID pandemic. 2 years ago when it came, the staff prepared and became ready with modifications of treatment. This was also the direction of all treatment sites as mandated by the Department of Health. Instead of patients coming in daily for DOTS, they were given 2 weeks supply of medications and monitored through video observed therapy. All patients were also screened for COVID, given management when they turned out positive. So as we celebrate the World TB Day today, March 24, 2022, and the 10 years of existence of the VSMMC PMDT Satellite Treatment Service Center, the achievements and accomplishments, we, the PMDT STC staff, commits to serve our patients to more decades of service and hard work. Congratulations, everyone. These are our staff, the doctors, the nurses, our field nurses and support staff, and please call us at 0999-882-3996. Again, congratulations to the VSMMC Programmatic Management of Drug-Resistant TB Satellite Treatment Center.